Okay, welcome back to the part 2 of this video. In the last part, I have discussed everything about injuries due to cold. Everything about injuries due to cold, hypothermia, chilblains, frostbite, everything we have already covered. Now we will proceed to a part which is much more interesting. Why it is much more interesting? Because it has a power of deceit. This is why forensically it is very important, which is the burns topic. This is more important from a forensic point of view, and this is going to occupy the major chunk of this video. Okay, now but we will start the video by first discussing the generalized effect of heat, where the entire body is subjected to heat. It is called as hyperthermia. I am sorry, hyperthermia, and we will cover it in short. Now, when I speak of hyperthermia, it means the entire body is subjected to more heat. But the question arises, what is the normal body temperature? The normal body temperature, like I told you even in the last video, is 37 degrees Celsius. In Fahrenheit, it is 98.6 degree Fahrenheit. Okay, so whenever the temperature increases, body temperature increases, it is called as hyperthermia. There are three main effects of hyperthermia which I will discuss, but let's first understand what happens to the body when the body is subjected to generalized heat. Let us understand that in 1 second. Let me find a empty slide. Okay, so think that this is the sun. This is the sun or any hot source which provides generalized heat. Let's take it as the sun, and this is a person who, it's a very hot day, he is exposed, he's been working out in the sun, so he is sad because he is exposed to a lot of heat. What does the body do? The first system, the first organs of the body that try to counteract these effects of heat are the skin and sweat glands. So the skin and sweat glands, they become active and they start sweating, producing sweat. What does sweat contain? Sweat contains a lot of electrolytes. Always remember this. Okay, so this person is exposed to heat, he starts sweating. Now when he starts sweating, the sweat is supposed to cool the body. It is supposed to cool the body. If the body cools down to an appropriate level by the level of sweating, this person is now again is said to be in homeostasis. Now this person is a happy person. Okay, now this person is now a happy person because he has fighting off the heat by sweating. But let's say that even though he is sweating, but he is still not able to fight the effects of heat. Now becomes a problem, that even though he is sweating, but he is still, the sweating is not sufficient enough, or it's not capable enough to fight off the effects of the sun. Then we will enter into a new territory. What is this territory? So we had discussed that the person is exposed to the sun, he is sweating, and even after sweating, his body is not able to cope up with the effects of heat. So what are the three things that can happen? The simplest thing that can happen is called as heat cramps. What happens in heat cramps is that due to the extra sweating, lot of sweating in the sun, there is a loss of electrolytes. There is a loss of electrolytes. But remember, most important thing, there is a loss of electrolytes, but the overall fluid of the body remains normal. Even though there is a loss of electrolyte, the overall fluid remains normal in the first condition, which is heat cramp. Remember, this is going to be very important, why I am going to discuss in a minute. So because there is loss of electrolyte, these electrolytes are generally sodium and chloride. What will happen is there will be muscle cramps, particularly in the legs. and these muscles cramps will be painful. So this was heat cramps. Let's go increase the severity a bit. Next condition is called as heat exhaustion. What happens in heat exhaustion? First, the body loses a lot of electrolytes. There is loss of electrolytes, which happens even in heat cramps. But along with that, something much more important happens, which defines this condition, which is the loss of body fluid as well. Okay, so there is a loss of body fluid as well. This is the defining condition of heat exhaustion, that there is a loss of fluid. Now compare that with heat cramps. In heat cramps, the fluid is normal, but over here in heat exhaustion, there is a loss of fluid. So what will happen if there is loss of fluid? What happens is the BP, the blood pressure, is going to go down. Okay, and the heart rate, I'm going to draw a heart rate is going to go up. Okay, the heart rate is going to go up. The person is going to feel extreme weakness and an exhaustion. Now, even though the body is losing fluid, even though the body is losing electrolyte, will the body stop sweating? No. The body has only one mechanism to fight off this extra heat, which is by sweating. So over here, one of the most important things is that sweating is still intact. The person still keeps sweating. This is very important. Now, why the person still keeps sweating? Because there's a thermoregulatory center in the brain. The thermoregulatory center is active, so the person still keeps sweating. Now, in the next condition, something more peculiar happens. Something more deadly happens. The next condition is called as heat stroke. This is a deadly condition. Over here, what happens is eventually there is a loss of electrolytes. That's the first gate that is broken, loss of electrolytes. Second gate which is broken, loss of fluid. After that, the third gate, which is the most important gate, is broken. What happens is the thermoregulatory center becomes non-functional. Thermoregulatory center becomes non-functional. Now, if the thermoregulatory center is lost. Now, if the thermoregulatory center is lost, will the person sweat or not? Yes, he will not sweat. So, sweating is absent. Sweating is absent. Most important, heat cramps, sweating is present. Heat exhaustion, sweating is present. But heat stroke, sweating is absent and the skin is therefore dry. Index due to heat stroke. If sweating is absent, the thermoregulatory center is damaged. What will be the body temperature? The body temperature will get immensely high. The only way to reduce the body temperature is by sweating, and the person is not sweating. So what will happen? The body temperature goes very high, sometimes greater than 41 degrees Celsius. The normal body temperature, let me again remind you, is 37. Okay, so here the body temperature goes very high. What will happen because of that high body temperature? Neurological symptoms. Person will have confusion. The person will have seizures. And finally, he may go into coma. There can also be something called as multiple organ dysfunction. There can also be something called as DIC. And mind me that all of these can cause the most important thing that we study in forensic pathology, which is death. Okay, all of this can cause death. So this is a deadly condition. This condition is a deadly condition. Let me once again explain to you in the slide. Most of this we have already covered. The skin in heat cramps is moist. The skin in heat cramps is moist. The skin in heat exhaustion is still moist. Over here in heat exhaustion, there will be rapid pulse, there will be hypotension, there is going to be pallor, there will be circulatory instability. The reason behind it, the pathophysiology we have already done, we know the reason. Heat stroke, most important thing that the skin remains dry. Heat stroke, the most important thing is that the skin remains dry in heat stroke. Okay, and the deadly one, the emergency one, is heat stroke. I wanted to make this a two-part video, but it's turning out to be so long. The lecture has turned out to be so long that I've decided to keep it to three parts. So burns will start in the next part. Part three will complete burns and will finish off thermal injuries over there. Bye bye.